we come to the last session of the day. So for those of you who still have some energy left and the ability to listen, we're going to try to wrap up and summarize some of the calls to action and the recommendations that we've been hearing in the individual panel sessions and presentations. So we're just going to go down our line and just summarize what we think we heard. Very happy to have people make suggestions if they think that there are better ways to do things. So if you do want to contribute, please put your hand up and we'll get a mic to you. And it can be as interactive as is possible. So who wants to start us off?
I'm happy to start off. I thought in general we had some fabulous conversations today in the three themes we had yesterday, and then adding women's health in today. And I'd love to see the conversation continue because I think we've only started. But for these remarks, at least, I'll just concentrate on the healthy aging input that we got. I think the lessons were many and various, but I think we learned a new word. We learned the word full span as something that perhaps we should be using all the more, and perhaps that might even be another directive for the UN to adopt, and maybe that's what it's called. I thought we talked quite a lot about concentrating more on stage rather than age, and all that it means in terms of the the data that we need. And I think we heard some fabulous information from several speakers about the demographic shifts, but also the criticality of digging into that data and not generalizing about it. Part of that was the falling birth rate, just to add to the mix, because I think that renders older adults to be more of a focus in terms of their capacity to consume products and services that are well designed for them. And I think AARP put a number on this in saying that the discretionary spend of the 50-plus population, I think, was $8.3 trillion, considerably bigger than the under 50. So let's not forget it. I think several speakers talk about the need for listening to and designing for older adults, doing more of that. That was a constant theme. I think we have a need for more data granularity in terms of those needs, a lot more insight that it would generate. And I think part of that is a two-way process in which we're thinking about specific issues that we need to tackle first. We talked a bit about literacy. We talked about, solving, for example, for deafness, solving for caregivers, both professional and otherwise. And I think those are all really critical issues, but we need to prioritize and we need to do a lot of collaboration around them. I think ultimately we have a huge scope for healthy aging, but I think it's best delivered by best practice sharing. And I think that was true across all of the themes that we had. I think there's a real role for all of us in terms of perhaps uploading our creative thinking. And I think ECH can be a convening force for that collaboration and that best practice sharing across these very themes, and love to see everyone continue the debate in that forum. So that would be my quick summary.
Okay, I think I'm next. I have a couple of points, and I had the pleasure to moderate the session on green health when we had the fantastic exchange and presentation of the best practices from around the world on the practices how to create and develop the sustainable healthcare. But some of my comments or recommendations to take further can be generalized to the other topics as well. So I will start from the collaboration. So that was again like something that this meeting, this event was open with, the collaborations. And of course, we know that we really need to, for solving healthy aging, making sure that data and digital is deployed in a good way. And then also for women's health, for green health, we really know that there are so complex issues that we really need to work across sectors. But we also know that those collaborations are not that easy, that we have to really facilitate them, cherish them. And as it was also said, that it would be great to be curious. So to invite people to the table to learn from them and not to convince them or challenge them. I like this very much. And I think that this would be my one lesson and one recommendation that I would take from this event. The other one is we also heard, and I think there is also an agreement that technology is there, legislation is there, opportunities are there, but then we have to still be very brave, and we have to change the mindset that we really have to believe that all this is possible. And again, also change the mindset to work together. We heard a lot about the challenges, and I think that it was sometimes we were into getting into this gloomy mood, how difficult everything will be with the aging population, with the women who don't have maybe quality healthcare, or then with the climate change. But again, we also heard a lot about the different investment opportunities. And I think that this is the key message, but also to make sure that we are building the better future and sustainable planet. We need to make sure that, of course, those investments are having impact in mind and not only money in mind, and then also having equality and quality healthcare in mind. So I will put this. And then on top of that, I think leadership. We really need the strong leadership, and doesn't mean the leadership on level of presidents and the ministers and so on, but we really need the local leadership, community leadership, and we all are leaders. So I would also put that forward. Thank you.
Okay.
Yeah.
Well, I'm still recovering from the women's session. So I think overall, I would agree. It's all about collaboration. I think one theme that resonated for me was best practices. And I think we could all benefit by collaborating globally with best practices and learning, because we all have, and I'll speak on the women's health aspect, we all have rural areas in our countries. We all have societal issues that we need to deal with. So I think best practices would really help expedite things. Another thing with the technology, I agree with you, the technology's there. We just have to figure out how to do the right patient journeys so that we care for patients in the right way. And that was really, I really enjoyed the aging discussions, just because it showed, there's proof of it, there's facts, but then there's also that emotional side of it that really we need to make sure that we're listening. And that ties back into the women's health session, that the themes I got was that we really need to listen to women. They have their intuition. We need to understand where they're at. They're in a certain role that has a lot of pressure. And, I think we need to unpack that. I also think that FemTech came up today, which I was really excited, because it's about funding women products and services that are really going to help women and empower them in the future. And then I also thought, the panel that I had the opportunity to work with, just really collaborative. And I think that a takeaway should be, we do that again. It's 2.0. And we continue to evolve, because women's health is so broad. It was hard when we first talked about how to narrow it down, and we still didn't even narrow it down to where we could. We just scratched the surface. And while you need to talk about the challenges, that's how we find the opportunities. So I think there were a lot of challenges talked about, but I think opportunities to improve. So I'm very optimistic.
Great. So I think looking at my reflections on where we got to, for all the speakers when we were preparing the program, the challenge that we set them was in 2024, the UN has the Summit of the Future. And what calls to action would the speaking panels, presenters suggest what topics would they like to see the UN at the highest level discuss and debate. And I have to say that I'm massively impressed by how many of the speakers addressed that, and that we had, I thought, tangible suggestions for how people can work together and what that agenda might be. I think the challenge to us is to go away after this and to think about how much work might be done between now and the summit of the future to produce tangible content to present at that summit. And that's a great position to be in, but the quality of the discussions, the ability of the organizations to collaborate and work with each other, and their willingness to do that was evident. So for us as the ECHAlliance, where we talk about connecting, convening, accelerating, and amplifying, we have all of so much material to work with. Personal reflections over and above that, if you like. Nurses as the untapped resources, but how to tap into the nurses is one of the follow-ups, if you like. Involving communities came up, and we know from people who've seen the diagram that's been playing of our ecosystems, that at the center of ecosystems, we have people, citizens. And that's been, in our 12 years of driving the ecosystem development, that has always been for us the hardest part of the circle. And the reason for that is that, I think I mentioned yesterday, it's easy to find expert patients. It's not easy to find ordinary people who have a health condition or caring. And lots of the advocacy groups and the professionals don't easily get to the ordinary person, whoever or whatever that may mean. I thought that from FH Europe, the tangible suggestion to move from cardiovascular disease to cardiovascular help and producing a code was a real tangible outcome. And then I thought that there were a number of suggestions which are really involve education and learning. So whether that was capacity building in low middle income countries, whether it was about what is the research standards needed to demonstrate that technology works, or that it's clinically safe, or that it's financially sound, or any combination of those things are really important as well. So another thing I heard was the dementia challenge, where we were saying, we all know that we have this problem worldwide, but actually what are we doing? And interestingly, the UK government at one stage initiated a dementia challenge to pharma, which has just sort of gone nowhere really, frankly. And I thought that was an interesting thing, because again, for the Summit of the Future, it is such a problem around the globe that you've got to think what policy might come out of that. So I thought that was another great area. So if anything, we're spoilt for choice in terms of literally the potential number of topics and actions that we can create. But I'm hugely, like Karolina, hugely optimistic, because the panels, with some prompting, were very prepared to share their emails and to start working virtually together on how we might prepare for the Summit of the Future. So all in all, that was extremely positive. So I'm just thinking, is there anything else that we want to tackle? I don't think there is.
Mm-hmm. So I will take forward on two elements. Thank you for addition and intervention. One thing I think what also we can put to the recommendations for the Summit of the Future is actually this global exchange. Like, we learn from each other, and we learn over those 2 days, having also the participants from Europe, from Asia, Africa, and US, we learn from each other, and we also learn how much we can learn from the countries in like Kenya, for example, how inspiring those examples can be, and how we actually can also apply those examples, those learnings in our world. On the Scandinavia, I live in Finland, so I wouldn't say that it's so much about legislation. It's about culture. This is like something of the years or of the decades of the development, and also the role of women in the society as such. So I would not ignoring the power of legislation, because I think that we can of course develop and progress by the with proper policies, implementing proper policies and supporting those social developments this way. But I think, I mean, I have this like broken records on the mindset, but I think like it's still like, you know, we have to change our minds to be able to actually embrace all those policies and all those opportunities those policies bring, because, you know, we can, one day we can vote on one policy and then the government change, and then we know what might happen. So yeah.
So I'm thinking, if we go back to thinking when we were at Nashville last, and when Vive was happening, and I think there's an organization called Springboard Enterprises, which is an all-women's venture capital advisory, where all the investments are into women's businesses, and they have a strong mentoring program where women executives are speaking to other women. So I think the US has got beacons of light, and that we need to foster and promote. So I think it's not all doom and gloom. But with that, I think we're gonna wrap up and just close with a few thank yous. So first of all, thank you to all the speakers, all the attendees, both in person and online, and we are very grateful for the quality of contributions that have been made. Watch out on our social media over the next weeks and month as we curate the filming of the sessions, and we will post the content so people can go back and re-listen or find things for the first time, because I think the content was so good that it would be criminal if we didn't do that. We have received an invitation from the UN to sit on the advisory board planning for the Science Summits, Summit of the Future next year, which we will take up. So all of the work that people have been doing, thank you very much. So all of the output of the last 2 days, we will feed into our role in that advisory panel and suggest the content. So that will, I hope, make all the contributions even more worthwhile. But I hope that everybody's understood what we are as an organization in terms of going back, convening, communicating, accelerating, and yeah, and I think that for me, what's really important in the amplifying, okay, what's really important is that we need people to help us. We need organizations to come together to actually contribute and help one another. So the appeal here, if you like, is that if you like what we're doing, it interests you, then get in the trench with us, roll up your sleeves and get stuck in and help us to actually progress and transform health and care globally. We are a membership organization. If you really like what we're doing, then by all means, please join. If you go online, you'll see how to do that. If you're a not-for-profit in your public sector, it's free to join. So please do that. And then my final comment is a small thank you, or perhaps a big thank you, to the ECHAlliance team who behind the scenes have for many months organized the program, all of our social media, all of the slides, chased all of our speakers, organized all the preparation calls. And of course, we have with us our COO, if you like, Heather, who, without whose skills and efforts, we might not have got onto the stage on time, found the hotel, found the building, got up and down in the lift. So all of those things that she is fantastic at organizing, I'm sure that the four of us would all like to say a big thank you.